Over the last decade, I have overcome numerous chronic health conditions, including fibromyalgia, chronic fatigue, irritable bowel syndrome, also known as IBS, and generalized anxiety disorder. When I was at rock bottom, I kept searching for the answer to 3 key questions. 1. Where do I begin? 2. What is going to make the biggest difference to my health? 3. Will I ever get better again? Over 10 years and one heck of a journey later, I now have the answers to my questions, and I'm going to share them with you within this video. 1. Where do I begin? Your very first step is to speak with your primary healthcare provider, such as your GP or specialist, about the health problems or concerns that you have. Before moving on to the next step, it is important that you let them know about the steps that you're going to take. Once you've been to see your primary healthcare provider, the next step is to educate yourself about what you should be eating and drinking each day to support and optimize your health. Why should you not start with sleep, stress reduction, exercise, or supplements? While you may think that you should start by optimizing your sleep, reducing your stress levels, starting to exercise more, or taking a multivitamin, while all of these can be very beneficial to your health, they are not the first place that you should focus your time, money, and attention on. You will struggle to reduce your stress levels without focusing on balancing your diet. Exercising is great if you're choosing the right type for you, and nourishing your body optimally, and a multivitamin should be there to help supplement your diet. It should not be there in place of a balanced diet. Therefore, from over a decade of trying to find the answer to, where do I begin? The answer is to educate yourself about what optimal nutrition is and how to introduce it into your daily life. The best way to learn about optimal nutrition. To educate yourself about how to improve what you are eating and drinking to help optimize your health and well-being, you have 3 choices. 1. Search the internet, books, podcasts, videos, etc. 2. Speak to a qualified nutritional therapist. Or 3. Enroll onto Nutrition the Corner pieces. If I was to start on my health journey again, I would do all 3. I would start with option 3, enrolling onto Nutrition the Corner pieces. This is because it is the cheapest way to access the foundational information you need to start optimizing your diet. By the end of the course, you'll have a much greater understanding of the phrase, you are what you eat. You will know what you need to do to quickly, easily, and effectively introduce a balanced, whole food rich diet. And you will know what your next steps are to continue building your health puzzle. Plus, Nutrition the Corner pieces has 2 modules that focus on reviewing your own health status and food diary, one at the start of the course and one at the end of the course. The information that you will get from doing the activities within these modules is what you need to take with you to your nutritionist or other healthcare provider. After completing Nutrition the Corner pieces, you may feel that you no longer need to see a healthcare practitioner as you've got the results that you are looking for. However, if you'd like to continue optimizing your health and well-being, you may want to seek the support of a qualified nutritional therapist. I have put a link in the description box below for you to our practitioner directory, where you can find information and links to a wide range of practitioners spanning a range of disciplines, from nutritionists to functional dentists, and each specialise in certain areas of health, from gut health to emotional resilience. By seeing a nutritionist after learning about and implementing the basics of healthy nutrition from Nutrition the Corner pieces, your nutritionist will be able to provide you with more advanced education and advice. You will also know by the end of the course what your biggest challenges are when it comes to implementing a healthy diet long term, and they can provide you with the support that you need. Additionally, nutritional therapists are trained to look for the root cause or causes of your ill health, and they can use their specialised knowledge and private testing to support you further. While you can see a nutritional therapist first, you are likely to spend a lot of money learning the basic information that you can easily and cheaply access through Nutrition the Corner pieces. Plus, this frees up nutritionists from educating their clients about the foundations of a healthy and balanced diet, leaving them available for more advanced and specialised support that they are so great at. Thirdly is to search the internet, books, podcasts, videos, etc. for more information and education. The internet and books are amazing places to find nutrition and lifestyle education. However, they can be a minefield. There is so much information available to you, provided for free by top healthcare professionals from all around the world. The only problem is not everything that you read or watch is true, safe, or effective. Therefore, these resources should be used alongside support provided by trained, qualified, and insured healthcare professionals. When choosing who to listen to, do not follow them blindly. Check that they are a credible source of information. Look for reviews, ask them about their qualifications, and do not rush into something thinking it will be a quick fix. You can find some really great blogs, websites, charities, podcasts, documentaries, books, and more over at THP Recommends. THP Recommends is our recipe, product, service and practitioner directory. If you are interested in the world of health and well-being, it is a resource that you'll want to know about. When I was in the depths of my ill health, I was desperate for the ladder that would come along and save me. I had limited time, energy and money, so I had to think hard about what was going to make the biggest difference to my health. Should I see a practitioner? Should I buy a specific supplement? Should I buy organic food? Should I join a yoga class? The options seemed endless, and I never knew what would make the biggest difference to my health. However, I quickly found that there was no one thing that was going to make the biggest difference. Instead, lots of smaller changes, when added together, had the biggest impact on my health and recovery. Just like the ladder that I was looking for, it turns out that each health supportive change was like one rung of the ladder. One by one, step by step, I made my way out of the depths of the hole that I found myself in. When I was in the depths of my chronic health conditions, I wanted a list, a guide, a roadmap of how to support and optimise my health. After many years of personal and professional experience in health support and optimisation, I now have a much clearer idea of the order in which the average person should focus their time, energy and money on, if they are looking to support and optimise their health and well-being. Therefore, from my personal and professional opinion, if I was looking to start building my health puzzle again, I would focus my time, energy and money in this order. 1. Speak to your primary healthcare provider, such as your GP or specialist. 2. Learn about the foundations of nutrition through Nutrition the Corner Pieces. This course was not available when I first started out on my health puzzle building journey, and this is why I've spent the last few years creating it for you. 3. Start to focus on rebalancing your circadian rhythm and your sleep. Aim to wake up, eat and go to sleep at the same time each day. 4. Introduce a slower or more gentle type of movement or exercise into your weekly routine. For example, walking, yoga, tai chi, swimming or casual cycling. 5. Focus on having more time for rest and relaxation, such as 15-minute breaks and a slow evening routine. 6. Reduce the number of toxins in and around you. Chemicals that can have a negative impact on your health are all around you. Some are unavoidable, but others are in your control. Check out THP Recommends for our top recommended products from personal care to food and drink. There's a link in the description box below. 7. Seek the support of a healthcare professional. I am still undecided as to who would be the best person for most people to go to. In my personal opinion, I would see a kinesiologist because I feel that they've had the biggest impact on my health overall. However, depending on the imbalances within your body, you may want to start by seeing a nutritionist, herbalist, Chinese medicine practitioner, osteopath, etc. 8. Focus on other important areas that can help to optimise your health, including rejuvenation, play, purpose and community. I will cover more about each of these in future blog posts and videos. 9. Continue building your health puzzle, and do not be afraid to start the whole process all over again. Building your health puzzle can take time, and while this worked for me, it might not work for you. Plus, do not attempt to do everything all at once. Choose one area to focus on first, or take small, easy changes from a few. To finish this video, I'm going to answer the biggest question that I had when I was in the depths of my chronic health conditions. Will I ever get better again? The short answer is, it depends. I was told time and time again by various people that there was no cure, there was no long-term hope, and there was no chance that I would ever recover from each of my chronic health conditions. And yet, through rebalancing my body, I've been able to get better. The answer to the question, will I get better again, all depends on the root cause or causes of your ill health. You could have nutritional imbalances, hormonal imbalances, unwanted pathogens, unwanted heavy metals, structural issues, genetic SNPs, energetic or emotional imbalances, and more. Some of these can be removed, some of these can be rebalanced, and others may not have a solution at this moment in time. The level to which they can be removed or rebalanced is also a factor impacting how much you'll get better. Therefore, it depends. To start gathering the information you need to understand the potential root causes of your ill health is to speak to your primary healthcare provider, such as your GP, and complete the health and wellbeing review as part of Nutrition the Corner Pieces. If you'd like to know more about our online course, Nutrition the Corner Pieces, or would like to enrol, you'll find a link in the description box below this video. I wish you all the best with building your own health puzzle. Happy puzzling!